Hi, my name's Shannon McDonald, and I'm a SEMO nursing student, and this is my medication administration video, and I'll be administering warfarin or Coumadin to Mrs. Jenkins. So the first thing I want to go over is the 6 rights of medication. So it's right patient, right drug, right dose, right route, right time, and right documentation. Next, I want to make sure that the physician's orders and the medication administration record line up. So the physician's record or order says warfarin, Coumadin, 2.5 milligrams by mouth daily. And the medication administration record says warfarin, Coumadin, 2.5 milligrams PO at 1800 hour each night. So then Coumadin, I'm going to explain a little bit about what Coumadin is. So it is an anticoagulant which prevents new blood clots from forming. And I'll be giving it to Mrs. Jenkins because of her past medical record of type 2 diabetes, hypertension, and atrial fibrillation. I'd also be giving it to her because of her recent hip surgery. Some side effects of Coumadin is hematuria, which is blood in the urine, hematemesis, which is vomiting blood, ecchymosis, which is skin discoloration due to bleeding under the skin, also petechiae, which is small skin spots due to bleeding underneath the skin, she could also see tarry stool, which is like a dark color or black color in her stool. And if she sees any of these symptoms, Mrs. Jenkins should contact her physician or her nurse. I'd also want to make sure that I monitor her lab tests monitor the lab tests of PT and INR. When her lab results were recorded at 0715, her PT was 18 and her INR was 2.2. For someone that's taking Coumadin, the range for her INR should be 2 to 3, but for someone who's not taking Coumadin, it should be 1 to 3. And then after reviewing the information, I'm going to administer Coumadin to Mrs. Jenkins. Okay, so the first thing that I'm going to do when I enter the room is perform hand hygiene. Next, I will introduce myself. Hi, my name is Shannon, and I'm going to be your student nurse today. And then before administering the medication, I will ask the patient if she is comfortable and if they're in a comfortable position. Ms. Jenkins, are you in a comfortable position to take your medications? Okay. I can also assist them in an upright position to help with swallowing if need be. Next, I will ask Mrs. Jenkins if how she prefers to take her medication one at a time or all at once. Mrs. Jenkins, do you have any preference on how you like to take your medication?
I think I'll take them all together if that's okay.
Yes, of course. Next, I will confirm patient identity, so I'll ask for 2 patient identifiers. Can you tell me your name and date of birth?
Ashley Jenkins, and my birthday is January 7th, 1947.
Nice. Do you have any allergies?
Nope.
Okay, I could also check the patient's wristband as well. Next, I'm going to assess her pain level. So, Mrs. Jenkins, I noticed in your chart that you were experiencing some nausea yesterday. Are you still feeling nauseous?
No, not today.
Okay, good. Have you noticed any other side effects while taking this medication?
Nope.
And then I'm going to assess her pain level on a scale of 0 to 10. So, Mrs. Jenkins, can you assess your pain level on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
I would say I would scale.
Okay. After I've done all that, then I will explain to Mrs. Jenkins and her family why she's taking Coumadin and any potential side effects and symptoms from taking the medication. So, Coumadin is an anticoagulant, so it prevents any new blood clots from forming. It also inhibits the synthesis of vitamin K, which inhibits blood clotting. You're on Coumadin because of your past medical history of type 2 diabetes, hypertension, and atrial fibrillation. And you're also taking this because of your recent hip surgery, and it's to decrease your risk of developing a blood clot because of your surgery. Some potential side effects that could happen is hematuria, which is blood in the urine, hematemesis, which is vomiting blood, ecchymosis, which is skin discoloration due to bleeding under the skin, as well as petechiae, which is small skin spots due to bleeding under the skin, as well as a tarry stool, so it's like a dark red or black color in your stool. Also, some other things that you want to consider while being on Coumadin is some dietary things. So if you'd like a diet that's rich in green leafy vegetables, that can decrease the effect of the drug. So you want to monitor how much green leafy vegetables you're intaking. Also, you don't want to take aspirin with Coumadin because that can increase your risk of bleeding. And then after I've explained to Mrs. Jenkins and she has no further questions, I can begin administering the medication. So the first thing that I'm going to do is do the 3 medication checks. So I'm going to take the medication out of the medical dispenser and I'm going to compare it to the physician's orders and the MAR. So I'll check the bottle, and warfarin Coumadin 2.5 milligrams PO, warfarin Coumadin 2.5 milligrams PO. After I've done that, I will take the medicine, I'll put it in the cap, and then I will do 2 more medicine checks. Warfarin Coumadin 2.5 milligrams PO, warfarin Coumadin 2.5 milligrams PO. And then I will do 1 last medicine check while I'm at the bedside with Mrs. Jenkins. So I'm at the bedside. Warfarin Coumadin 2.5 milligrams PO, warfarin Coumadin 2.5 milligrams PO. Once I've completed all 3 medication checks, I'll begin to administer the medication. And I remember that Mrs. Jenkins prefers to take her medication all at once. So I'll hand the medication to Mrs. Jenkins and provide her with a glass of water to help with swallowing. And I'll allow her to take some time to take the medication. While she's taking the medication, I will assess for any swallowing difficulties, and then I want to make sure that she has swallowed the medication. Mrs. Jenkins, did you have any trouble swallowing?
Nope.
Can you open your mouth to make sure that you swallow it? Good. After she's taken the medication, before leaving the room, and Mrs. Jenkins, I will make sure that she's in a safe and comfortable position. Mrs. Jenkins, would you like me to lower or raise the bed at all?
Lower, please.
Okay, so I will lower the bed. Once I've done that, Mrs. Jenkins, is there anything else I can do to make you comfortable?
I think I'm good. Thank you.
Okay. Once I've done this, I will take the medication and I will put it back in the dispenser and I'll leave the room. And then I will check the medication records and document that I administered warfarin Coumadin at 800 hour. And then after about 30 minutes after I administered the drug, I will come back and check on Mrs. Jenkins and assess for any discomfort, and I would take her vital signs. My name is Shannon McDonald, and this is my medication administration video.